If you register.
With only a month left to go before Kenyans can start accessing health services under the new Social Health Authority, for the very first time, the government made public various packages members of the authority will be entitled to. The maternity package, for example, has seen an increase of funds for both normal and cesarean delivery under the new health scheme. Normal delivery and essential newborn care have been capped at 10,000 shillings from the previous 5,000 shillings, whereas cesarean section and essential newborn care has been capped at 30,000 shillings.
We're going to finance it to the extent that is feasible. And that is important because in terms of communicating that, in terms of comparing it with the benefits package we had in the past, it is an improvement.
Under the Primary Healthcare Fund, the Social Health Authority will pay 3,000 shillings for embalming services and a storage fee of at least 500 shillings for a period of 5 days for its bereaved members. Under the Social Health Insurance Fund, a member will be entitled to at least 3,360 shillings for services accessed at a Level 4 facility and 3,920 and 4,480 at Levels 5 and 6 respectively for inpatient services, which shall include management of disease or condition while admitted. For outpatient services for conditions like diabetes, hypertension, sickle cell and asthma, the cost covered for diagnostic laboratory investigations is 4,300 for diabetes, 2,850 for hypertension, 6,800 for sickle cell and 700 shillings for asthma. This, according to Social Health Authority, will be limited once per year per person. Similarly, members will be required to pay for any additional charges.
Following the development in the country surrounding the finance bill, we again recognize the need to optimize the benefit package within our available resources or our constrained resources.
For hemodialysis and hemodiafiltration, the scheme will cover up to 2 sessions per week for its members at a cost of 10,650 shillings per session. On the other hand, for peritoneal dialysis that will be covered for 12 months, SHA says it will pay at least 85,200 per month with a copay. Pre-transplant recipient evaluation has been capped at an annual limit of 150,000 shillings per household. Consequently, the recipient surgery cost has been limited to 700,000 shillings. Still under its renal care services package, the Social Health Authority will pay at least 168,000 shillings for donor nephrectomy and 200,000 shillings for post-renal replacement therapy per household. Similarly, there were concerns regarding other packages like hearing aids, whose cost has been capped at 55,000 shillings. This, however, did not sit right with other stakeholders due to the caveat imposed by the authority on it being issued only once per lifetime, among other concerns raised during the validation of the tariffs to the benefits package under the Social Health Authority.
You will give them once, they are going to live for 70 years. They are going to be contributors likely. Is this fairness?
Meanwhile, Kenyans have been called upon to continue registering with the Social Health Authority to facilitate smooth access of health services from October. Gloria Milimu, KTN.